This was I came out with it in June 1974. 2 months later, the Journal of the American Medical Association, by virtue of the number of lives saved in 2 months, named it the Heimlich maneuver, which was very gratifying. Well, about not quite a year later, there was another newspaper article by the same reporter, and it told how a Dr. Victor Esch, the chief surgeon of the Washington, D.C. Fire Department, was at Rehoboth Beach in Delaware, and he helped a lifeguard pull an unconscious, non-breathing, drowning victim, a man, out of the water. The lifeguard did CPR, which was the routine thing to do, and then said, "He's dead." The doctor said, "Can I try something?" He said, "Yeah, doctor, go ahead." He did the Heimlich maneuver, and each time he did it, water gushed out, and the man recovered. And that spread quite widely. We had many reports of lives saved as that word got around. It was perfectly reasonable that drowning victims, when they have inhaled water in their lungs, they cannot breathe and you cannot blow air into the lungs. You had to get the water out. A leading lifeguard organization that had 35,000 lifeguards, now has 50,000. They provide lifeguards for all the city pools throughout the country and outside the country, as well as for swimming places like Kings Island, and they also did it for the Coney Island pool. And they took all of their lifeguards, and they had them do the Heimlich maneuver first on drowning victims, and this is important, who were unconscious and not breathing, not those who were gasping and so forth. At the end of the 5 years, they reported it each year. They had used it on 152 unconscious drowning victims, and saved 147. That was 97%. And it was well established that with CPR, at least 50% do not survive if they are unconscious and non-breathing drowning victims. But I say this, report this for one reason, to save some lives. Every year in this country, 1,000 children die of drowning, most of them in the home. Under age 5, the leading cause of accidental death is drowning. It's toddlers fall into, they're in the bathtub, they fall into toilet bowls, pails of water, and pools. The general public does not know of the possibility of helping them with the Heimlich maneuver. And these 1,000 died, many of them very likely needlessly. We don't know who's going to be next, which kid is going to die. So what we must do is try to at least spread the word so that when this happens, the parent will know at least to try this possibility. I might say, by the way, in regard to CPR, which you know is pressing on the chest and blowing into the mouth, and that's been a very, very effective thing. But there was a study done at the University of Washington, Seattle, on 4,000 heart attack victims. And they found that in half of them they taught the caller on a 911 to use CPR with mouth to mouth. On the other half, they left out mouth to mouth. They found out that when they did the mouth to mouth, more died than when they just pressed on the chest. And I think that since the year 2000, the Red Cross and Heart Association now uses chest compressions alone. On one occasion, I was speaking to a large group of people, not doctors, in Washington, D.C., and at the at the question section, a woman stood up and she said, "My sister is 61, has advanced asthma. She was having a severe attack. I knew she was going to die, and I knew no first aid. I only knew the Heimlich maneuver. I did the maneuver, and she stopped. Her asthma attack stopped." Well, that ran around in my mind for a while, and I started looking into it. In an asthmatic, due to allergy or to contaminated air, the small breathing tubes of the lung become narrow. That's why they wheeze when they breathe in. And all asthmatics have mucus in their lungs because they have chronic inflammation. When they have an attack and they breathe in, and they try to breathe out, the mucus blocks their breathing out. So they breathe in again it blocks breathing out. They can sometimes inhale from their inhaler, the medication. But if they get up a little further, they can't breathe in or out. They can't inhale, and that's when they die. And 5,000, more than 5,000 asthmatics, mostly children, die every year in this country during an asthma attack. That's more than 10 a day. A hospital did a study on 60 children ages 4 to 12. Yes, 12. On half of them, they made believe they were doing something. On the other half, they did the Heimlich maneuver. What they did every week, once a week, they did just 3 Heimlich maneuvers, gently, or have them do it to themselves, because you're not injecting a piece of meat. You're trying to get the mucus down into the larger windpipes where they can be coughed up. After a year, they found that doing that with the maneuver, the children who had it done had a better quality of life. Their breathing function, their lung function was better. Now, I want to say this. If you really believe a person is going to die, by the way, you may remember a few years ago, 2 or 3 years ago, at Northwestern University, a student had a severe asthma attack on the football practice field. This was widely publicized. He got a severe attack of asthma. He pulled out his inhaler and couldn't use it and dropped dead in front of everybody. The point is, if you feel strongly that a person is going to die during an asthma attack, it is worth doing the Heimlich maneuver very gently in the hopes of stopping it. I might say in regard to doing it once a week, 3 or once a week, the asthmatic could speak to his doctor about that, but each patient is different, so that the doctor should make that decision. I thought you'd like to know about it. I'd like to change a little now and tell you about something that has had a great deal of meaning in my life, if I may. During World War II, I was in the Navy, as it was said, and I joined the Navy with we like ships, we like the water. In a typical Heimlich maneuver, I ended up in the Gobi Desert in Inner Mongolia in northwestern China. There were just 12 of us then, 6 Navy, 6 Marines, and the purpose was we had 2 weathermen in the Navy. They got the weather every day and radioed it to the Pacific Command because our weather hit there 3 weeks later, so the movements of every ship and plane depended on that. My job was we were behind Japanese lines, was to treat the Chinese in the area medically, which I did, to keep them on our side. I treated hundreds of people. The Marines, the 6 Marines, trained 250 Chinese guerrillas to protect us. One of my Chinese guerrillas got shot in the chest. I tried to treat him, and he died in my hands. And here I was, this 24-year-old doctor. Nobody had died in his hands before that night. It wasn't possible, by the way, to save someone shot in the chest then. And I saw his coffin go off on an ox cart that night, never forgot it. About 20 years later, in the early 1960s, I was writing a book on post-operative care and thoracic surgery. And I said, if the lung collapses, if you're shot in the chest, if you have a pneumothorax, the bubble bursts, you get a leaking air in the chest, or you open the chest for surgery, what you do is, the lung collapses, of course, from which they would die if it continued. You put a tube in their chest, and you attach that to a regulated suction. And that took the air out of some blood that was there, and the lung came up, and you kept the patient in the hospital for 2 or 3 weeks on this suction. And then you could take out the tube and send it home. And describing it, I said, this works like a valve. It lets the air and blood out and doesn't let anything back in. And I thought, why not a valve? And I considered different valves and realized that the best one would be a flutter valve, a flattened piece of tubing, because it would let air and blood out and nothing back in. So I went to the 5 and 10 cent store. Now it's the $5 and $10 store. And I got a noise maker. We used to call it the raspberry or the Bronx cheer. I sterilized it, put a tube on it, and when a man came in with a collapsed lung from pneumothorax, put the tube in him, stayed with him through the day and the night, taking occasional x-rays. The flutter valve, which was the noisemaker, was working. And the lung came up and it stayed up. And with it, I took it to a major manufacturer of medical equipment. And they right away started manufacturing what became known as the Heimlich chest drain valve that we're passing around. It was 1964 when it came out, and the Vietnam War was on. The military immediately made hundreds of these and shipped them to Vietnam. And every soldier carried in a sterile plastic envelope a sterile valve on a tube. If your buddy got shot in the chest, you didn't need a doctor or a corpsman. You took the tube and put it through the bullet hole with a piece of tape on. The valve let the air come out, the blood came out, and the lung came up. And it saved hundreds of our soldiers. On Hill 881, one of the most severe fights, they reported to me, 34 of our men were shot in the chest and 32 cut off an arm. A few years later, I was invited to Vietnam with a group of chest surgeons to meet their chest surgeons, the people ambassadors established originally by General Eisenhower. And when we arrived at the airport in Hanoi, we were introduced to their chest surgeons. When I was introduced, their chief chest surgeon said, "Oh, Dr. Heimlich needs no introduction in Vietnam. Everyone knows his name." I thought, well, here's the maneuver. And then he said, "The American Friends Service Committee of the Quakers kept us provided with Heimlich chest drainage valves throughout the war, and it saved tens of thousands of our people." He said, "Dr. Heimlich will live in the hearts of the Vietnamese people forever." I will tell you that I shed tears at that moment. somewhere between 150 and 250,000 valves are used every year for keeping the lungs expanded. If you go into an emergency room with a collapsed lung, they put the tube in, they no longer attach it to suction and keep you there for 2.5 weeks. 2.5 weeks. They put the tube in with the valve on and they send you home and you come back in a couple of weeks to have it taken out. I just want to say that I believe that I have repaid that Chinese soldier. Thanks.
You were talking about the need to do the Heimlich maneuver gently with asthma victims. Is there a potential side effect if you do it too hard?
No, it's just a matter of course, you always have to be careful with the maneuver that you don't do it too hard. But you can do it smoothly because you don't have an object to come out. If you did it, people can be injured if you do the maneuver too hard. But those who learn it properly use it properly.
Yes, Julie.
Dr. Heimlich, how long did it take for the Red Cross to adopt the Heimlich maneuver?
How long did it take the Red Cross to adopt the Heimlich maneuver? Some time.
Yes. I got it out in June of 1974. I do believe it was 1985 or 6. In 1985, the surgeon of the United States Public Health Service issued a declaration that was widely publicized. And it was written, it was a declaration by the Surgeon General of the United States, Dr. Koo. And he stated in simple words, he said that never use a backslap. It can drive the object deeper and cause death. The Heimlich maneuver is safe and effective and can save adults and children by really getting rid of the choking object. And after that, the Red Cross accepted the maneuver.
It was a challenging period, I don't know if you read about it, but for him, because the Red Cross was critical of the maneuver for a long time, until the Surgeon General figured out that this procedure, as compared to what the Red Cross was suggesting, was a big change. Yes?
I just want to say that I know the Red Cross does a lot of good things, but in the last few years there have been a series of articles in the New York Times and elsewhere telling about the problem with the blood bank. Half of the blood banks in the country are run by the Red Cross. The FDA has fined them $20 million because of the number of AIDS patients who are infected with their blood.
Yes.
If you are alone and you happen to be choking, do you have a recommended or a suggested technique?
We have someone's hand up here who spoke to me.
Yeah, Dr. Heimlich's maneuver saved my life. I was by myself with a bunch of kids and we're all eating those little chocolate malt balls, and one got stuck in my throat, and I'm a little children. So I took a chair and I put myself over the chair and it just popped right out. Like this. Like this. Saved my life.
But
So
what
We've tried to spread this, and it's in one of the posters there.
It's right here.
That you have. You can either use do the maneuver to yourself in the usual way, or do it just described.
Yes.
The question that I have is actually to the people out on this side of the lectern. But how many in this room have a direct experience with the Heimlich maneuver? I will say please stand and give applause.
it's neat that we have had a chance to listen to one of our legends.
Doctor is writing a book. You want to talk about that?
He's writing a book on his life. And so that will be coming out next year. So I think it's a neat thing that we could get him to come over and tell us a little story about what he's done. Thank you.